And I would ask, Mr. President, unanimous consent for those of us that are on the floor here to carry on a colloquy talking about a public option.
Without objection.
And Senator Brown, I would just say that the number in New Mexico, you know, you have a range on your chart over there, but the number in New Mexico is actually two companies controlling 65% of the market. So we're talking about a situation that isn't very competitive. And I think that's the bottom line of what we've been hearing. We've had our colleague from Oregon, Senator Merkley, here. We've had Debbie Stabenow from Michigan, other colleagues here on the floor speak to that situation in their states and why we should proceed with a public option. And let me first of all say to the senator from Ohio, I appreciate him, his leadership. I know that he was on the HELP committee. The HELP committee is the one that wrote the public option bill that we have the opportunity to put in the final legislation here. So he was on the committee. Some of us are getting into writing the legislation now, but one of the best public options that's out there is the one that came out of Senator Kennedy's committee. It's been passed for a couple of months, and it's sitting right there ready to go if we just put it in. You know, when we talk here on the floor about a public option, what exactly are we talking about? I think people have a right to know a little bit about what we're talking about when we say public option. And I think if I outline that a little bit, people will see why it's so important to have a public option. So let me give a little bit of an outline. First of all, it would be voluntary. We're not forcing anybody to get into it. We're talking about a voluntary system. So you would have a choice to get into it based on whether or not it would fit your particular circumstances. The public option would not be subsidized by the government. It would be fully financed by premiums. So this would be something where people would be paying premiums, the premiums would come in, and we wouldn't be adding to the deficit. You'd be creating a good, solid insurance situation and insuring people. We've heard, as Senator Brown has talked about here a little bit, over and over again, and he put up a chart over there about these incredible salaries. Well, one of the things that a public option would do is you don't make profit for the shareholders. You have the opportunity to take those premiums and put them all back into health care. And so that once again is something that's very important. But let's look here at this chart that Senator Brown's just loaned me here for a minute. But look at the total compensation for CEOs of major health insurers in 2008. Aetna, $24.3 million. Cigna, WellPoint, Coventry. Look at these salaries. I mean, this is a total for about 8 or 10 of these of $85 million. $85 million in salaries. What we're talking about is money being spent on health care for people through a public option. One of the other things that I think would be a hallmark of a public option would be having low administrative costs, since it operates on a nonprofit basis. Now, one of the things that you should know about these insurance companies, where you have these CEOs working, is they have administrative costs in the range that we've heard about, 30% administrative costs. So what happens here is the money comes in on the premiums, but they spend an incredible amount of time going back and forth, denying claims, telling doctors they shouldn't put that in, they're not going to cover it, and it builds up into a big administrative cost. Well, the great thing about a public option is that you don't have that high administrative costs. And one of the comparisons there, Senator Brown, as you know, and I know Senator Sanders from Vermont, I think Medicare has 3% administrative costs. So here you have a comparison, 30% to 3%. One of the other parts of a public option that I think really makes a difference is exerting bargaining power to obtain discounts from providers. That could make a big difference if we had a public option operating out there. We'd offer savings to subscribers with lower premiums. We should follow the same insurance requirements as private plans. And what we would offer through a public option would be low cost and high value. So basically, what we're talking about here is keeping insurance companies honest, driving the costs down, and having a competitive market.